Also, I would like to, of course, thank the Kennedy Krieger Institute, and our new president and CEO, Dr. Bradley Schlaggar, is here with us, and I'd like him to say a few words.
Thank you, Dr. Belcher. It's a pleasure to be here and to welcome you all to this conference. I'll just say very briefly that what's happening in this room in this conference represents the fundamental values that attracted me to Kennedy Krieger Institute. I consider it to be a core values, what I want to be a part of, and it's just an absolute pleasure to be here and participate. And Kennedy Krieger Institute supports this initiative and will continue to do so. We want to hear back about the experience, the benefits, so we can strengthen the program. Thank you very much.
So at this point, I'd like to introduce one of Hopkins' own, Dr. Shelley Tru, who actually received her medical degree from Johns Hopkins, as well as her MPH from the Bloomberg School of Public Health, and completed a residency in public health and preventive medicine here. So we'd like to welcome her back. Currently, she serves as a senior medical advisor for the Baltimore City Health Department, and in her role, she leads convenings with city providers, particularly around the area of behavioral and population health initiatives. She previously served as a senior medical advisor for the Be More for Healthy Babies and the Bureau of Maternal and Child Health, where she oversaw the Bureau's provider outreach efforts for infant safe sleeping trainings. She's previously served as a senior health policy fellow with the FCC's Connect to Health Task Force and worked to expand broadband availability to underserved areas for improved access to telehealth, and was a medical fellow at NBC News Health. So without further ado, thank you very much.
Good morning, everyone. Good morning. Thank you so much, Dr. Belcher, for inviting the Baltimore City Health Department. And thank you, Dr. Stone, Dr. Nelson, Genesis, and Dr. Lance for also putting together this amazing conference for today. When I was looking at the agenda, I was just thinking, oh my goodness, it's going to be so exciting for the rest of the day and just so much learning as well. As Dr. Belcher mentioned, I am the Senior Medical Advisor at the Baltimore City Health Department, and I'm actually here on behalf of Dr. Lena Wen. She's our Health Commissioner, and as you may have heard in the news, she's actually leaving the Health Department and will be leading Planned Parenthood and be fighting for women's health and women's rights. So it is personally bittersweet for me and for the Health Department, but I cannot think of a better advocate to be fighting for us at this climate and at this time right now. So in the agenda, you see that I was going to talk only about Be More for Healthy Babies, but I decided, well, at the Health Department, we actually do a lot more work. So I was going to share actually 5 stories, some of them a little bit longer than others, but I will be focusing on Be More for Healthy Babies. And I just also want to say that thank you for all of your work as well, because you are leaders already, and I've heard last night when I was meeting with Dr. Belcher and Dr. Stone and many of your other faculty members about the amazing work that you're doing. So just thank you already for fighting for equity and fighting for diversity and inclusion. We wanted to start off with a little bit of where I work. So at the City Health Department, we are the oldest continuous health department in the country. So we actually started in 1793. And for those of you who know Baltimore City and know Fells Point, back in 1793, there was a yellow fever outbreak. And so that was ravaging what is now an area full of bars and restaurants and a fancy boutique hotel. And the governor at that point decided to appoint 2 health officials to address this health epidemic. And so since then, the health department has grown. So now today it's over 800 employees and a budget of $126 million. So it sounds like a lot, but we don't have enough resources. And actually, most of that money come from grants. So with grants, it's fantastic because it allows us to be innovative, it allows us to be nimble, but then at the same time, we still have to think about sustainability. So a very few portion of that money is actually from city funds and something that we can expect every single year. One of the principles of the health department is that we see health in all policies. So whether it's education, whether it's crime, whether it's jobs, we want to weigh in because everything has a health impact. The second policy, or the second guiding principle for the health department is that we go where people are. So we actually have over 20 buildings as part of the health department. The picture that you see in front of you, that's where I work at the main building in 1001 East Fayette Street. But we have clinics. There's one really close to here on 620 North Carolina Street, so near the Hopkins Outpatient Center. And then we also have another one on the west side of Baltimore. We also have several WIC sites. We also have several early Head Start sites as well. But we also go where individuals are, so we have mobile clinics. So we have a clinic that provides STI, hepatitis C, HIV treatment, and substance use disorder treatment, and we also have needle exchange vans. And so another guiding principle for the health department is that we believe in harm reduction principles. So the needle exchange van has been in existence in Baltimore City for over 20 years, and you can imagine when it first started that there was a lot of hesitation about it from other members, but we really believe that with needle exchange that you can decrease the transmission of HIV and hepatitis C, and over the years the transmission has gone down by over 90%. This is a map of Baltimore City, and you may have seen this a number of times. So we have around 620,000 individuals in Baltimore City. And as you know, we're divided in the sense where we are in neighborhoods. But the irony in all this, and this is a map of the life expectancy, is that there's a 20-year life difference, and depending on where you live. And so in Baltimore City, we are so lucky in that we have some of the best healthcare systems in the world. We have Hopkins, we have University of Maryland, we have Sinai, Mercy, you can name it. We actually have 11 acute care hospitals in the city, plus the VA, so a total of 12. So if you look at northwest Baltimore, you can see in the Pimlico, Arlington area that your life expectancy will be around 66. But if you walk a few blocks away in the Mount Washington, Cold Spring area, your life expectancy will be closer to 85. And so it's not about access to health care. And I'm so lucky to be standing in front of you where all of you understand that health is not health care, that it's really more about where you live, where you work. It's about the social determinants of health. And now we're also looking at, well, we know the importance of social determinants of health, that your health is not dictated by the four walls of a clinic or four walls of a hospital, that there's more to that. But we're looking at, well, why does a map look like this? Why is it that in certain areas the life expectancy is lower? And why is it that if we were to pick any other topic, so if it was poverty, if it was education, it would look very similar? And it's because of the determinants of equity, that there have been long-standing institutional racism and policies set in place to oppress a certain group of individuals. And so these were 100 years in the making, and these are something that is not going to be dismantled overnight, but it's going to take some time. And this is something where we all need your help, and we all need all of our help to sort of fight for equity and fight for inclusion and diversity. So I wanted to share, the food access map because it shows that the high food priority areas in Baltimore City, it looks very similar to the life expectancy map as well. And this map also correlates to the rate of cardiovascular disease in the city. So the darker shades of purple are higher rates of cardiovascular disease, and then the salmon color is the areas of high food priority area. And so there's approximately 1 in 4 Baltimore residents who live in a health food priority area. But children in Baltimore City are more disproportionately affected. So it's 1 in 3 children as well. And so what is the health department doing in? So this is just a taste of some of the things that we're doing, and hopefully can get you very excited to eventually work with us as well. We have a virtual supermarket program, and so we're currently in 14 locations. And this is an online program where in select places in the city, so libraries, public housing, senior housing, you can order your groceries and then have them delivered there. And these are strategically placed in the high food priority areas. So since its inception and until early 2018, over 1,200 residents have been served, and over $500,000 worth of groceries have been served as well. Now this is just a part of a more comprehensive food strategy, but this is an area where we're working directly in the social determinants of health. I wanted to talk about asthma because I think when you think about children's health in Baltimore City, you have to talk about asthma. Currently, 1 in 3 Baltimore high school students say that they have asthma. And then when it comes to ER visits, Baltimore's rate is 3 times higher than that of the state for asthma. But we have a community asthma program, and our director, Margaret Schnitzer, she is an amazing, amazing individual. And really, the program, it's an evidence-based program. It's based out of Seattle, and it connects from the healthcare system and also partners with the Department of Housing. So they do 3 home visits. It's free to any Baltimore City resident, as long as they're between the ages of 2 and 18. And they go over education of what are the triggers of asthma, what can you do inside your home to prevent an asthma exacerbation. And over the 3 visits, what they've seen is nearly a 90% decrease in symptoms of their patients and of their clients as well. And so what we find is that we have all these amazing resources at the City Health Department. We just need to let everyone know that they exist. And so we would love to have your help in spreading the word of some of our programs. This is a paper that came out several years ago, and it's actually from Cincinnati, and it's really to tie between housing code violations and with asthma. And basically what it is showing is that in areas where there are high densities of housing code violations, that as you would expect, the ER visits, the inpatient visits, they're higher because there is that correlation. And it's really just to drive the importance of the social determinants of health, and no matter what outcome, what health outcome you're looking at. The third story I want to share is Be More for Healthy Babies. And this is a story that's really dear to my heart because I worked with this initiative for about 2 years. The team is fantastic, and I'll tell you how it first started. So in 2009, so not that long ago, the city saw that it had the 4th highest infant mortality rate in the country. That year, 128 babies died, 102 moms had stillbirths. And then the disparities was high. So Black babies were dying 5 times the rate of white babies. And the city said, this is unacceptable. We cannot accept this. What does it say about a city that can't even protect its most vulnerable residents as well? And so what it means today is that those babies who died in 2009, we have 10 empty classrooms as well. So the city decided to look into it, into why our babies were dying. And so the number one reason was that babies were born too soon and too small. And the second reason was that they were not sleeping alone on their backs in a crib. So they were basically in unsafe sleep positions. Now this is different nationally, where the number one reason why infants are dying is because of congenital anomalies. But in Baltimore City, it's due to preterm birth and low birth weight. So the way we view it is that this is a public health issue. We can do something about this. And so in 2009, Be More for Healthy Babies was born. And so when we talk about vision, this was the vision, that all of Baltimore's children are born healthy and grow and thrive in healthy families. And so this was a partnership of the public and private partnership. There's over 150 partners with this initiative. And it includes other community-based organizations, includes libraries, includes barbershops, includes churches as well. And it's the idea that if we can go together, we can accomplish a lot more than just pursuing something by ourselves. So not only was it Be More for Healthy Babies, looking at making sure that the babies were born full term and healthy weight, and then that you decrease the number of babies dying from unsafe sleep, but you're also helping women and families advocate for themselves, so developing self-efficacy, and then also building resilience in families as well. So this is the population health pyramid. As a public health advocate, I love the public health pyramid, and so Tom Friedens has his population pyramid. This is adapted from his triangle, from his pyramid. And basically, if you're in a setting where you have limited resources, how do you allocate those resources? And so what is on the bottom is where really we should be investing the most. So on the bottom, it should be the social determinants of health. But oftentimes, it is really the top, so the one-to-one care. And we see it in the hospital setting. In the hospital setting, there's a lot of money that's being spent in the ICU and the inpatient setting. But really, more money should be allocated in prevention and in primary care clinics. It's the same thing with maternal and child health at the health department, in that most of our funds are actually going to home visiting programs, so the one-to-one care. And not to say that that's not important, but if we were to really strategize and decide where to put our money, it would be in the social determinants of health. The other thing to notice is that this pyramid also has underlying principles that everyone agrees to. So it includes equality services, trauma-informed care, includes equitable policies, and an anti-racist approach. And this is something that Be More for Healthy Babies decided very strategically to name, that it was an anti-racist approach, because they truly believe, and we truly believe, that that's the approach that we must all take, and it must be community-driven as well. Now, this is a social ecological model. I love frameworks, and I just love how Be More for Healthy Babies work. And it's the idea where you can't just have another program. You just can't have another service. You have to have multiple layers of what to do. So you have to have policy. You have to work with community. So, for example, for infant safe sleep, on the policy level, in 2009, the mayor made a proclamation where if you were delivering at one of the Baltimore City hospitals, before you left, you had to have education on how your babies should sleep safely. I have a 2-year-old son, and I'm proud to say when I delivered at Hopkins, before I left, they did teach me about the ABCDs of safe sleep. So I know that all the hospitals are doing this, especially Hopkins as well. On the community level, Be More for Healthy Babies, they partner with so many partners, as I've already told you, but they work with barbershops, they work with churches as well to not only provide education on how to keep your babies healthy, so breastfeeding, but they also provide information about services that are available. And then in terms of the services and organizations, there is actually a central care coordination system in the city. So what that means is that if you're a mom who's expecting, or if you've just given birth, we actually have social workers, we have nurses, we have community health workers to coordinate care. And what we found out was that if you were not linked up to this care coordination service, then you were 5 times more likely to experience a fetal or infant loss. So it wasn't so much that you're filling out this referral form, it was being sent over to the central care coordination system. It was really the linkage of services. And then the important pieces of interpersonal, so family dynamics, family support is extremely important. And then on the individual level as well. So someone who is very wise, my former boss, Rebecca Deneen, who actually leads Be More for Healthy Baby, told me that you can make a whole public health strategy out of maternal and child health. And it's because of the life course strategy, right? That if you want to think about baby being healthy, you can't just think about their 2-month visit, 4-month visit, 6-month visit. You can't even just think about their birth. You have to look more upstream. So you have to look at the mom while she's pregnant and ensure that she's healthy. But you have to look even more extreme than that. You have to even look at her childhood, because we know that ACEs play effect in one's health outcomes. And now literature has also shown us that there is intergenerational effects, that stress from prior generations affect our DNA even now as well. And so I love this model just because it's beautiful, and it just shows many different layers of Be More for Healthy Babies. And really underlying this all is undoing the structural racism that affects each level. So the wonderful thing about Be More for Healthy Babies is that it flips the narrative, right? This is Be More for Healthy Babies. It started off very sad, but it's a success story. So over the past several years, there's been a 35% decrease in infant mortality, a 71% decrease in number of sleep-related infant deaths, nearly a 50% decrease in teen births as well. And then in terms of the disparities, a 60% decrease. So it went from 5-to-1 to 2-to-1 as well. And we work closely with the neighborhood Upton Druid Heights, and they actually had one of the highest infant mortality rates in the city. But in the past 3 years, they've experienced 0 infant mortality. Yeah, so just very, very proud to have worked with Be More for Healthy Babies, and they're working on a new strategic refresh right now. So they're continuing their primary outcomes of working on infants' lives, but they're also making sure that babies and toddlers are safe, and then all babies and toddlers are ready for school. And part of their work is really also working on themselves. So we've all undergone the Undoing Racism training that's held by the People's Institute of Survival and Beyond. It's a 3-day training. It is absolutely fantastic. They've had now over 200 members of Be More for Healthy Baby involved, and that's actually really changed the way that this initiative and this organization operates. We now have a community advisory board who are compensated for their time, who are provided food and transportation, because in my line of work, I get paid for what I do. But oftentimes, those who live in the community, they bring in so much expertise and they're not as valued. And so now this structure has changed, and they're providing a lot of input into Be More for Healthy Babies. We're also, at Be More for Healthy Babies, every month we talk about sort of the issues that are going on in this world today. So we talk about maternal mortality and how the rates have been very high and how they disproportionately affect those of color. We also caucus as well. So those individuals of color, we come together every month to talk about issues that we feel that would be safe only in this type of setting. And those who are not of color also talk and talk about sort of learning about undoing racism as well. I next wanted to talk about the Baltimore City Countable health communities, and because I wanted to emphasize the social determinants of health. So as you've seen, there's many ways to address the social determinants of health, and I'm sure in your line of work, you are addressing that by advocating for your patients, both in the healthcare setting, but in outside as well. But this is a really, really exciting opportunity for the city and for our healthcare system. And it is a grant. It's a grant from Center for Medicaid and Medicare Innovations. And it was a nationwide grant. So there are 32 awardees. But out of all the 32 awardees, Baltimore City is the only one where it's citywide. And it's the only one where a public health department has been awarded. And it's over 5 years. And so for Baltimore City, what we're doing is we're trying to identify social needs in the healthcare setting and then navigate the patient and connect them to resources successfully. But this is also an opportunity to really unify our systems and technologies together. Because for those of you who are working in the clinic setting, you know that each hospital, each clinic has their own different electronic medical records, and oftentimes they don't talk to each other. And that becomes very, very frustrating when you're trying to take care of your patient. Fortunately, in Maryland, we do have the CRISP, so we do have the Health Information Regional Exchange that will allow for providers to talk and find more information, but we still need a better unified system. And this is an opportunity to also make the case that social needs in clinical care is both effective and cost effective as well. And so what we're hoping to do is really collect that information so we can make the case and know exactly what our gaps are. Maybe it's housing. I suspect it is housing, but it's also probably education, employment as well. And now we can actually quantify that and bring everyone together so we can rally around these causes. So for us, we have to screen at least 40,000 patients each year and then navigate 3,000 patients as well. And then we have to track the patients to see whether or not their social needs have been made. But for us, it's a technology piece that we're the most excited about. So first, we're hoping to align how we ask in the city about social needs. So we know that certain places will ask just about housing. We know that certain places may ask just about utilities and work. And we know that some of these places, they don't ask the same questions. And so it's very hard to sort of interpret apples to oranges. But with this initiative, we're hoping that it'll be the same set of questions. The second thing is that we're hoping that all clinicians, that all providers will see the results of those questions. So I think right now, those of you who are in social work or who are thinking about pursuing in social work, in nursing, you may see some of these, the answers to these questions in your line of work, but we want to be in the position where everyone sees this. So if I'm treating a patient with diabetes, I want to know what their hemoglobin A1C level is, but I should also want to know, are they living in a high food priority area? What is it like to get their groceries? Do they have to take 2 buses to get something that's healthy as well? The third thing is that with this project is that we're hoping to create a tailored community resource inventory. When we talk to various people in the city, we realize that there are over 10,000 resource directories. And for some of the resource directories, it lives in someone's head. And for someone else, it's literally a binder of just scanned brochures over the past 10 years as well. And so what we want to do is something that create this resource directory that's accessible to all. And so this hopefully will be a tool that all of you can use in the future. And the other thing that we want to do is that we really want to have all this care information, care management information in one location as well, so everyone can access it. Because right now, what we have is many initiatives going on in the city, but not everyone knows what each other is doing. And so we believe that technology would be a great solution, especially working with CRISP. Finally, I want to talk about the opioid epidemic. And I want to talk about this because you can't talk about the health of Baltimore City without talking about the opioid epidemic. And this is something that's affecting our patients, our children, and our youth as well. So the epidemic in Baltimore City, what you'll see is that the number of overdose deaths has increased over the past several years. So in 2011, it was less than 200. 2016, it was nearly 700. 2017, it was over 700, so 761 deaths. And the other thing I want you to notice is that in 2012, there were 4 fentanyl-related deaths, and then 2016, over 400. And fentanyl is an opioid that's a lot stronger than morphine or heroin. So if it takes 30 milligrams of heroin to unfortunately kill an individual, it takes 3 milligrams of fentanyl to kill someone. So it's a lot more potent. But I also want to say that trajectory, it wasn't always the case. In fact, this epidemic has been in Baltimore City for several decades, and I know now we're calling it a disease, and it's because it's affecting a different demographic. But it was actually getting better in Baltimore City, and it was getting better because there was treatment. So the red line is the number of overdoses. And then the green line that's rising above, that's the number of buprenorphine treatment. So methadone, buprenorphine, and naltrexone are one of the 3 FDA-approved medications for opioid use disorder. And then the blue line that's in the middle is the number of patients being treated for methadone as well. So at one point, we were having 300 deaths in a year, and now that it had gone to less than 200. But with fentanyl, this has shifted the narrative of the epidemic. And I want to let you know that if you compare us to other metropolitan counties in the United States, we have, unfortunately, the highest overdose fatality rate. So we are literally in the epicenter of this epidemic. I know it's nationwide as well, but this is one of the biggest public health crises that we are facing. And so what do you do about this? So the city health department in the city has a 3-pillar strategy. So I just want to talk about it briefly because there is a lot of room for collaboration and we need all of your help. We need your help in all the areas that I've mentioned, but we also need your help in this area as well. So there is an antidote for someone who's dying from an opioid overdose, and that antidote is naloxone. There's very few side effects. You can give it to children, you can give it to pregnant women as well. And so in Baltimore City, you no longer need a prescription, and that's because Dr. Wen has issued a standing order. So you can go to any pharmacy in Baltimore City, and we've had staff members go to every pharmacy in Baltimore City to ensure that they have naloxone, and they will provide it to you. Now, if you have Medicaid, it's $1 copay, but oftentimes it is waived. If you have private insurance, it'll cost a little bit more. And you can get the Narcan, which is intranasal version, or there's an auto injector as well. But I mean, for the city, it costs us $75 per pack. So there's 2 doses of the intranasal naloxone in it. That costs us $75, and that's a 50% discount. The other formulation that I mentioned, which is the auto injector that talks to you, it's very fancy. In 2014, that medication cost $690, and today costs $4,500. So that's a 550% increase. So even with the $75 discount we have, you can imagine that it still is a lot of money as well. And if we want to give naloxone to every single resident in Baltimore City, and that's something that we would love to do, that would cost us $45 million. That we just cannot afford to do that. But with the naloxone that we do have and we do provide, everyday residents since 2015 have saved over 2,800 lives. And we're sure that this is an undercount because not everyone decides after they administer naloxone to someone else that they decide, oh, I'm going to call the health department and let them know. So we think it's very much undercounted as well. But we realize also that naloxone is not the silver bullet in this epidemic. This is just one part of it. And so we really need to work on increasing access to treatment. And so in Baltimore City, we know that over 25,000 individuals have opioid addiction, but we also know that treatment works. So this is the medications with the counseling and with the wraparound services. And that decreases mortality by over 50%. But the Surgeon General has told us that only 1 in 10 get treatment. So imagine that if it was any other disease, if it was cancer, and only 1 in 10 got treatment, we would be up in arms and we would say this is not acceptable. But for addiction, somehow it is, and it's because of stigma. And so I need all of your help in fighting that stigma. We are working on many initiatives, and sitting here with me is Dr. Joseph Brodin, who's actually helping us in one of the initiatives, and that initiative is called the Levels of Care. So it's based out of Rhode Island, and it's a way for hospitals to respond to the opioid epidemic that's comprehensive. So it's not just about prescribing policies on how you're treating your patient's pains with opioid analgesics. It is also making sure that you have treatment available for patients and then also providing naloxone. I think from our standpoint, we have some of the best healthcare systems in the world, and this is a very common disorder. So all of our healthcare systems should be able to address patients with opioid use disorder. We're also working with law enforcement. So, I mean, for the past several decades, we've been arresting people for their addiction. And we put them in jail, we put them in prison and say, well, good luck. This is how you're going to get better, and not realizing that they actually have a disease. And so with the law enforcement assisted diversion, we're working in West Baltimore, and instead of arresting them, we're providing them with intensive case management and linking them up to treatment. So finally, the third pillar is reducing stigma and preventing addiction. And you may have seen some of this advertisement on our billboards, and it's really to emphasize that addiction is a disease, treatment works, and recovery is possible. And we have a 24-hour, 7 days a week hotline that anyone can call. So you can call for your patients, and what they'll do is either give you information or make an appointment for your patients as well. And they'll actually follow up with your patients and ensure that they went to their visit. We also have Get Naloxone, Save a Life at don'tdie.org. So I want to thank you today for just allowing me to come and speak and talk about some of the Baltimore City health challenges and some of the work that we're doing. And I really appreciated Dr. Fisher's point about we're not here to really solve problems, but we're here to make a pathway. And all the work that you're doing is actually making a pathway as well. I do want to end with a quote that my boss always says, and she's actually quoting from Dr. Martin Luther King Jr., that we are now faced with the fact that tomorrow is today. We're confronted with the fierce urgency of now. And so we are living in a time where there is a fierce urgency of now. And so we need all of you in part of this fight to help protect our families, our youth, our children, our babies, and our fellow residents as well. So I just want to commend you again for your work and just really looking forward to working with all of you in the future. Thank you.
Are there any questions? Any questions? Mike?
Was that from a specific research article, or how would I get access to the contributing factors?
Oh, yeah. So
that one. Yeah.
It's this one. So it is available on our website as well. So we have both Healthy Baltimore 2020 that has some citywide information about the health of Baltimore City. And then there is I want to say it's a community health needs assessment. And then there's a Healthy Baltimore white paper that talks about the health outcomes. And so you can access this information. Yes. So Healthy Baltimore 2020. And then there's a white paper as well. So if you look up the Baltimore City Health Department's website, there's actually a whole data section.
You know the title of the white paper?
I think it's Baltimore 2017 white paper, but don't quote me on that. Those words are there, but I probably jumble them up. So. Yes.
Hi, I was really appreciative that I'm back here. Sorry.
Oh, great.
I was really appreciative that you talked a bit about what the health department's doing for the opioid epidemic. I was curious to know how you guys feel about safe injection sites and whether or not that's something that you're looking at pursuing.
That's a great question with the safe injection sites. I think at this point, there has to be city legislation that needs to be passed in order for them to be feasible in the city as well. But from our standpoint, I think we always believe in harm reduction principles, and we want to decrease the transmission of diseases such as HIV and hepatitis C and many more.
Hi, thank you so much. For the information that you mentioned about the CMMI grant to kind of create accountable health communities, I was kind of paying attention, but you're mostly screening adults. Are there also kind of like an aspect of it that will also screen in terms of like connection to care for children, in terms of like getting the care and the support that they would need to address their issues?
So it's not limited to adults. We haven't, in the sites that we've already implemented this, just because of the locations. It's only been for adults, but we want to expand to children as well because we feel that there is a lot of need as well.
And then the second follow-up to that, would there also be linkages in terms of for children connecting them to school, like connecting that information to schools? And maybe that's another question I'll follow up with you, but how in terms of addressing the barriers of like, addressing like FERPA and HIPAA and like allowing all these different systems to connect to each other? How has that like started?
Oh, yes.
roll out?
So with the Accountable Health Communities, I think that community resource inventory tool will be very helpful in addition to connecting to the schools and school counselors. There was also another project that I was working on. It is on pause right now, in that we were trying to get pediatricians' absenteeism data because that is something that they should be looking at. And then if they found that the student is absent, whether even if it's not due to a medical condition, that there would be a relationship and partnership with the schools. And I think right now it's easier to do it with community schools because there are social workers there are set individuals who can help with navigating resources for the child and for the families as well. Yes, I think that's something that's the most exciting part of the Accountable Health Communities is that while we're trying to build this infrastructure, there's also a lot of room for a lot of partnerships, and these are exciting partnerships that we're hoping to further develop as well.
I know you spoke about the opioid crisis and then the maternal child health and everything like that, but you also briefly spoke about the intergenerational trauma.
Yeah.
So given the recent research regarding epigenetics and the way transmission of trauma from one generation to another, and the population are primarily being minorities, and looking at that aspect, is there a mental health category to with children, adolescents, or adults? Because a lot of times it seems like things that are being missed are somatic symptoms as a result of like depression or anxiety, and specifically in the schools, a lot of times it gets seen as like ADHD or conduct, but a lot of times the children have like PTSD or they have depression.
Oh, absolutely. And a lot of this is collaborations with the schools as well. We work with Behavioral Health Systems Baltimore. So they are our local addiction agency. And so they were also working with the schools. And I don't know the exact numbers of how many schools have mental health counselors, but they do. And then there's a recent grant called Promoting Student Resilience, and it's awarded recently after 2015. And it's working in specific neighborhoods in West Baltimore and working with the schools, working with the nearby health clinics to promote student resilience and addressing the mental health components of it as well. So I would love to connect with all of you to just provide some more information about that piece.
Thank you.
Any other questions? I would like to thank Dr. Choo. This is really amazing work that you're doing, and very important, and particularly the emphasis on the social determinants of health, and kind of thinking about in the work that we do, how do we integrate population health into that work and partner with all the great initiatives that are taking place at the Baltimore City Health Department.